Okay, so these are the stretches that I'm gonna have you do. You can do them in this order or out of order, it doesn't really matter. If you find one that you feel like is really helping, then do that one a little bit more. But the first one you're gonna do is your knee to chest. So you're gonna lay on the ground or in your bed or wherever you wanna go that's comfortable. You're gonna have your legs out straight, bring one knee to your chest and just pull it to your chest. And then when you're here, I want you to just take some deep breaths, like into your lower abdominals, just breathing really big. Think about breathing into like your lower back, into your ribs, into all through there as you pull your knee to your chest. So you're just relaxing. Full deep breath in. Slow exhale out. And you're just going to hold that for maybe 3 or 4 full breaths, and then you'll drop that leg down nice and slow, and then bring the other knee up to your chest and do the same thing. So the leg that is straight, you want it to be on the ground. You're going to kind of reach out through that foot, through your heel on that leg, so it stays down. And then you're pulling the other knee towards your chest. It's not an excessive stretch, so you're just bringing it to where it feels comfortable, and you're really just focusing on your breathing as you do that. And with every exhale, that should help you to relax into the stretch. So relax your shoulders. If you can't get your knee in that far, just grab like a strap or a towel to help assist you to do that. Okay, so 3 or 4 breaths per side for those. Then from there, you're going to go into your glute stretch. So you can do this one of 2 ways. You can either do just like what we just did, where you pull your knee in towards your chest, but then you're going to bring it across your body towards your opposite shoulder. So when you do that, you should feel that all through your glute on that side. And so you're going to breathe, again, doing the same thing, just breathing. Full breath in, slow exhale out. And then what you can actually do here is you're going to push your knee into your hand and your hand into your knee. So you're just pushing into each other, and then relax, and it'll come a little bit further into the stretch. And then you're going to push your hands into your knee into your hands, hold for maybe 3 seconds, and then relax, and you'll be able to go a little bit further. So from a different angle, so we're here, you bring your knee in towards your chest, bring it over towards your opposite shoulder, and then you're going to push your knee into your hands into your knee, and then relax and let it come the other way. So again, from a different angle, you get your knee, you pull it towards your chest, you bring it across your body. Once it's across your body, you're going to push your knee into your hands into your knee, hold for maybe 3 seconds, and relax, and that knee should come closer to your opposite shoulder. You'll feel that all through the glute. And then once you do like maybe 3 pushes and relaxes, then just do your breathing after that. So maybe 10 seconds or 3 full breaths after your 3 pushes. That one's going to be one that's going to be really good for that glute and sciatic, piriformis, all that whole area. So that's a really good stretch to do there. Always when you come in and out of the stretches, just go real slow in and out of the stretches that you're doing. The next one is a Cobra Press-Up. This one's very good, especially if there is a disc issue in your low back or something's pinched down there. It's not going to feel great at first. So I'm going to have you just start. You're going to lay on your belly, and you're just going to bring your elbows into this position here. If this is painful, just go a little bit further down and just go into so you'll start just straight, start working your way in to wherever feels comfortable for you. Once you're at a good position, then you're going to breathe really full and deep into your low back. And then you can keep working on getting yourself to that upright position here where you're to the point where your elbows are right underneath your shoulders. And then you can work on trying to extend and come back down. And you're going to try to do 10 of those if you can. So if you can't, if you're like, oh my gosh, that hurts so much, then just stay a little bit lower, and just work on your breathing in that position until that gets easier. Once you kind of sit in this position for, sometimes if it's like really bad, you might have to just hang out here and breathe for like 3 minutes, and eventually it will get less, hopefully. If it doesn't get less, then don't do this particular movement. But typically this is really good because it opens the space between your discs to let the nerve have room, so it's not being pinched. So that's why this one is good, but it will typically not feel great at first if it's really inflamed. So give it a couple minutes, try and work your way up, really focus on the deep breathing into your lower abdominals and lower back area. And then if you can, get those press ups and do 10 press ups if you can get there without pain. So then after that, you're going to go into a psoas stretch. Well, right after that, if you want, you can counterbalance that with a child's pose stretch, just real quick. I don't like to hold that one for too long just because we just did all that work in the opposite direction to open up the space. I don't want to then pinch it back up. So then we're going to go into a psoas stretch. So for this one, if you're comfortable in a kneeling position, on the ground, you can either put a pillow underneath your knee, or you can just kneel on it, but sometimes it's not comfortable for a lot of people. And all you're going to do, you're going to be in that kneeling position. I want you to kind of think about pulling this. So if my right leg is forward and up, you're going to pull that hip back, but then shift your weight forward, reach up and over. Okay, so the idea is to just get a nice stretch through here. And you might want to bring the leg out a little bit more. You can, so when you do this, you want to make sure that you're not arching your back to do it. You want to keep this together, and you're just shifting your whole body forward and then reaching the arm up and over. And you should feel that all through the front of your hip. And again, you're going to do full deep breaths, maybe 3 to 5 breaths, really focusing on the exhale. Inhale, as you inhale, you're breathing into the lower area of your abs, and then slow exhale. And obviously you're going to do both sides for that. Another option, if you don't want to kneel on the ground, would be to have something to put your foot up onto, like if you had a step to put your foot up on. I'll just use this real quick. So if I were to put my foot up on a chair, the higher the thing is, the better for this particular exercise. I don't have one to show you, but you're going to put your foot up on something and do the same thing. You'll just shift forward, reach the arm up and over, and breathe into that. So the reason the higher the thing would be is it takes your back out of it, so you can actually get the stretch where you need the stretch. And then the last exercise stretch to do is the windmills. So you're going to be in like a fetal position, one arm on top of the other. You're going to reach and then make sure that the top knee does not slide back. So as people rotate over like this, their top knee tends to want to drift back. You don't want to let that happen. Your knees should be one on top of the other, and that shouldn't change at all. So you reach and rotate. Take a deep breath. Exhale, and then bring it back. I typically like to do 6 or 7, where you can just go open and close real quick like this, and then on the last one, you'll just hang out and take those full deep breaths. Again, with every exhale, it should be a little bit easier to do. I don't know if I could give you maybe a different angle to so you can see. So again, my knees are stacked. You're going to reach and then bring the arm up and over to the other side without letting your knee drift, and then bring it back. So you'll do all of that on one side and then all of that on the other side. Okay, so good luck with those. Let me know how they go, and if they are seemingly good or not good, or if they cause any pain or discomfort or anything like that, let me know. And we'll go from there. All right, have fun.